Most pediatric kidney stones are preventable through early identification of risk factors and proactive intervention, yet our current primary care system lacks systematic approaches to prevention. We need to fundamentally change how we think about kidney stones in pediatric practice. Current gaps are significant and widespread. Kidney stones are not included in standard well-child visit screening protocols. Family history assessment, when done, often misses stone history or fails to recognize its significance for the child's risk. Dietary counseling focuses primarily on obesity and diabetes prevention without considering kidney stone risk, even though many of the same dietary patterns drive both problems. I'm proposing integrated screening protocols that would catch high-risk children early. Routine family history of kidney stones should be part of every well-child visit, with positive history triggering increased vigilance. Urinalysis at key developmental ages can detect early abnormalities like microscopic blood or crystals before symptoms develop. Dietary assessment tools that identify high-risk patterns, excessive soda consumption, inadequate hydration, high-sodium processed food reliance, should be standard. Intervention opportunities exist throughout childhood if we look for them. Anticipatory guidance about hydration should begin during infancy, teaching parents to recognize adequate fluid intake. Dietary education during early childhood, when eating patterns are being established, prevents problematic habits from forming. Adolescent counseling needs to address energy drinks, supplements, and other risks specific to that age group. Practical primary care tools would make this feasible. Risk assessment questionnaires taking just minutes could identify children needing closer attention. Age-appropriate hydration goals give families concrete targets. Evidence-based dietary recommendations for stone prevention, integrated with general nutritional counseling, don't require separate interventions or significant additional time. The medical home concept, primary care pediatricians serving as the hub coordinating all aspects of care, works well for stone prevention. Pediatricians can coordinate with pediatric nephrology for high-risk patients who need specialist evaluation. They can ensure appropriate referrals when screening identifies problems. They can provide long-term monitoring of children with stone history, watching for recurrence and adjusting prevention strategies. Healthcare system changes would support these clinical improvements. Payment models need to reward prevention rather than just reactive treatment. Currently, pediatricians get paid for treating sick children, but not adequately compensated for time spent on prevention. Integration of nutrition expertise into primary care practices, having dietitians available for consultation, would enhance dietary counseling quality. Public health campaigns educating families about kidney stone prevention before problems develop would create informed partners in prevention. Success stories demonstrate feasibility. I've seen practices implementing systematic stone prevention protocols who report reduced stone incidence in their patient populations. Children whose kidney damage was prevented through early intervention represent invisible successes, problems that never happened because of good primary care. The broader vision is shifting pediatric nephrology from reactive subspecialty care to proactive primary care prevention. Most children will never need to see a nephrologist if their primary care provider identifies risk early and implements evidence-based prevention. Subspecialty expertise remains essential for complex cases, genetic disorders, and children who do develop stones despite prevention efforts. But the goal is making kidney stones rare in childhood rather than accepting them as increasingly common. This requires commitment from multiple stakeholders, pediatricians willing to incorporate screening and prevention into already busy practices, healthcare systems supporting prevention through payment models and resources, public health authorities conducting education campaigns, and families engaging actively in their children's preventive care. The payoff is substantial: healthier children, reduced suffering, lower healthcare costs, and prevention of chronic kidney disease that would otherwise affect these children throughout their lives. Kidney stone prevention in pediatric primary care isn't just possible, It's essential if we're serious about protecting children's long-term kidney health.